And
Oh God, I'm not ready.
I'll let you know. Almost there.
I'm ready. Yes.
All right, we're live. Welcome everybody.
Wait,
Podcast
we're
number
not-
4. Huh?
What?
This is already off to a terrible start.
Hello. Good to see all your faces again.
Yeah, everybody, welcome. Project SIP podcast number 4. Thank you so much for being with us tonight. It's been a crazy couple weeks, but we're happy to have you here with us tonight. Before we get started tonight, obviously a lot has happened since the last time that we were live. And I want to address one of those things real quickly by going over to Kylan. Kylan, would you like to give a couple quick thoughts?
Yeah, good evening, everybody. Again, as Alex said, welcome to episode number 4, live and in effect. Thank you for being here. I think many of you all have heard about, what's happening in Minnesota right now involving, George Floyd and the Minnesota Police Department and the officers involved. It's enlisted a lot of feelings, a lot of raw emotion, and quite honestly, has really jarred our national consciousness. And we really do plan on, in our broadcast, digging into this in a lot more detail in our upcoming broadcast on June 11th. But I did want to let everybody know, let our viewers know that this is something that's on the forefront of our mind, and we want to make sure that we address this as more facts come out, because we want to engage, as always, in a very substantive discussion. What I do want to state, though, as I've seen the video, I want to unequivocally say that after watching this tape that, George Floyd should be alive. He didn't deserve to die, and that justice does need to be served, when all the facts come out. I actually would like to ask you, the viewers, for your thoughts and your feedback. So please utilize the comment section to share your thoughts and it really help guide our discussion during the June 11th broadcast, because not only is this our broadcast, this is your broadcast as well. And so we'd love to be able to engage and have a great substantive discussion. And we here at Project SIP really thank you all in advance for offering your insights to the broadcast. So thank you again.
Thanks, Kylan. As Kylan said, this is a topic we will be discussing on the next podcast, which will be June 11th. So if you guys would like to be there for that, let us know. And if you guys have any thoughts on how you'd like to approach the topic or any other topics that you all would like to discuss, please reach out. Let us know. Let us know in the comments. Let us know on the page. We are here to listen. So with that, I want to send it over to Lewis for the first topic of the night. Lewis, take it away.
Well, before we jump into that, I just kind of always like reminding everybody where we're at in terms of the stats for the coronavirus, because it's interesting to see it over a 2-week period. I know we get all the information every day, but just seeing it in 2-week chunks, see what the changes are. Presently, we're at 1.7 million cases with now crossing 100,000 deaths. Although, thankfully, we do have about almost 400,000 people that have recovered from this. I don't think that stat is brought up nearly enough. So hopefully we can get a lot more recovered as opposed to deaths. And that being said, that brings us into the first topic of reopening the economy versus public safety. Now, I know in the last couple of weeks we have had those stay-at-home protests, although those seem to have died down now that everybody is actually able to get outside. And, it seems like just being cooped up for a while, everybody's gone a little cabin feverish. So I just wanted to kind of throw this question out there to really anybody that wanted to jump in right away. How do you guys feel like the reopenings are being handled? Do you feel like it's being rushed, or do you feel like it's, we're being overly cautious?
So I'd like to jump in on this first. I've really personally loved the way that California has handled the coronavirus from start to finish. I think, and I've said this to many of my friends, I think Gavin Newsom should run for president after all of this, because he's handled it amazingly. And the fact of the matter is, you look at all the counties that have reopened in California that have moved over to phase 2.5. The only counties that are really missing for that are the high density counties like Marin County, Contra Costa, Alameda, Santa Clara, San Francisco. All of those are the ones that have actually stayed closed for the time being, or not stayed closed, but I think they're only, if I'm not mistaken, in phase 2 right now, which is like mostly essential businesses opening up. I have to have someone check me on that to be sure, but I think most California counties now have moved to phase 2.5. But I think a cautious approach is really what's keeping California at the forefront of this, and I think they're doing a really great job. So,
Bill, you had something to say?
Absolutely. So like kind of following on what California, up here in Washington, we are doing a phased in approach as well. So I'm actually in major support of that, in the sense of taking the time to step by step. And I believe one thing that I'll highlight about the whole entire West Coast is the fact that a lot of our leaders are following what experts in the field, especially, that follow science, freaking are giving them advice to. So it's just a matter of like, they're going off of that and the numbers and the data. Where you don't see that is where in states that, in this entire crisis, and one thing that I've noticed is that, yeah, it highlights along party lines, which is kind of sad to say, in the sense that what is valued in one, not even just in particular party, but in just leadership. The whole thing is the fact that maybe you, it's being highlighted, the fact that what's being coveted more so than over public safety. So it's just a matter of, in states like, say, for example, Texas, right, or more conservative sized states, you're going with more, hey, we need the economy to get up and running over, public safety. I think there's a big balance that needs to be done with that. Yes, the economy is extremely important. I'm extremely concerned personally of what we're walking into financially as a country, given all the stimulus payments out and what we're doing and the amount of debt that's going on. But at the same time, you can't write a check for a human life. Well, you can, but what I'm saying is, I believe a phased-in approach is appropriate. I believe that monitoring is appropriate. I believe that we need to that those in leadership that are reacting to the data, I think, is the most appropriate. So, and this is still a virus. This is still something that we're still struggling to understand, right? So that's the other part about it too. Is like, we're still learning about this thing, and we're doing the best we can with the knowledge that we got.
On that note, I realized that at the beginning of each show, we actually introduced the new person on the show.
Okay, so good. I just started talking. We're good.
I think I might have forgot because he's a Seahawks fan, something to that effect. But anyways, to the stream, first time on, I'd like to introduce Billy Adamski. Go ahead and give us
Wow.
Adamski, I'm sorry. Go ahead and give a quick a bio about yourself, and then we'll move on.
Quick bio about myself. So I'm originally born on the East Coast. And I have New York blood running through me. I was raised in the Bay Area of California. I joined, I've known Alex here since freaking high school. And Vladimir. I joined up the Army in 2008, the height of the surge of Iraq. I left, I did my time 4 years, and I now serve as a recruiter in the Washington Army National Guard. I live up here. I am married, going on 10 years this year. I have a new baby girl, about to be 1 year old next month. Holy crap, I thought guard duty was hard. And I am a graduate student. I just finished my master's in education. I also got my bachelor's, major in history, minor in political science. And I'm actually thrilled to be here because I remember talking to Alex a long time ago about doing podcasts, and I finally get to be on. So I'm excited to be here. Yeah, I'm a Seahawks fan. Get over it.
That'll be a debate for another day.
Absolutely.
Thank you for that introduction, man. We're happy to have you too. And sorry we didn't do that earlier. It's kind of been a scuffle.
Fine, at least I got
to start out. So
yeah, we're off to a great start.
Off to a great start. One of our best. I'd
so
like
I just wanted to jump in and just say, has anybody actually done a COVID-19 test?
Tried to. The whole thing is so up at the local military installation that in my local area, the whole thing is that we were possibly exposed to somebody, and the whole thing is that of course I have a new baby girl and my family, and I'm the essential worker that's still out and about. So it's just a matter of like, we went to the base to get tested. You have to meet a criteria in order to get tested. But at the time, there were limited amounts of tests. So if you didn't meet the criteria and you weren't showing as horrible symptoms, basically, if you're not dying in the car, you're not going to get tested.
So it was a pretty high bar to clear, is what they were making it seem like. I recently got tested.
How is it?
It's a very interesting experience. I happened to have done one of the drive-through tests. Took all of 30 seconds. They stick a Q-tip, poke the back of your throat, wiggle it around for a little bit, and then they get another one. And well, not really a Q-tip. It's more of like a small little cotton swab on a very tiny plastic wire that they then shove up your nose and give it a little twirl for about 5-6 seconds, and then they pull it all out and you're all done.
So wait, they go throat to nose?
No, they go
two separate.
Nose all the way. Yeah.
Nobody goes throat to nose, man. Come on.
It wasn't as bad as I was expecting it to be. It's definitely a little uncomfortable. So anybody that does need it, it is something that you could do, if they allow you to have that test done, if you're unsure. I happen to be an essential worker that comes in contact with a lot of people every day, not really sure they're interacting. So boss said, yeah, I want to go get tested. So I did that, and negative, thankfully, thank God. Huge relief. Now, there have been some discrepancies about the accuracy of most of these tests, namely the antibody tests. The throat and nasal swab for the viral test seemed to be doing okay. Actually, Sham, you want to jump in here?
Oh yeah, I just want to add a quick point because I do agree with Bill what you said. The one thing that I feel like is constantly overlooked about the whole reopening process, and of course, the economy needs to reopen. I think the fact that there's such a pressure for it is proof of just what how structurally primitive the United States system is, because there's really no infrastructure in place like in other countries, but that's a whole separate topic. I think what's overlooked is reopen everything. Things are not going to go back to normal. And there seems to be this collective belief that once everything, even if you see a drop in decline in infections, the economy as we knew it is not going to just magically go back to normal. And by the time it recovers, it won't be the economy that we knew. If anything, this whole entire ordeal has shown the cracks in our approach to our free market policies and all of that. But I feel like it needs to be really emphasized. Things are not going to go back to what they were. And I think the biggest problem, besides the fact that we're going to see massive spikes in infections, which is unavoidable. There's no two ways. Like, you can't open the economy and then avoid that. But within the coming months, a lot of these businesses that have been rushing to open are still going to have to shut down, because there hasn't been enough support for small businesses in the first place to basically support them beyond just these few months. And you're not going to see a return. I mean, just the fact that social distancing alone is going to drop the capacity for most physical businesses is proof that it's not going to be able to recover the way that everyone seems to be thinking. So that was kind of my point about it.
Let's give I want to give Billy a chance to respond to that.
So definitely we're going to have a post-COVID world that is completely new to the United States. One thing that I want to point out is the fact that other countries have been doing such precautions, I would say. I mean, we've all seen images from China or Asian continent and whatnot, in the sense of smog. Okay, wonderful. But I mean, wearing masks and taking precautions. I think this is going to be a new part of life. It's new to Americans because we have been very good at sheltering our population and putting priorities. Our priorities have always been individualistic, or more pleasure over everything else, right? So it's a culture shock. I think our country is in the middle of a major culture shock, one that we can definitely adapt to. However, we're going to take a hit. One thing that I am, like I said, I highlighted the fact of I'm interested and I'm a little worried about the amount of debt that we are going into. We already came into this problem with a high amount of debt. And now we've just tacked on more of it. So yes, I mean, it's absolutely necessary that we need to, the safety of our population comes first. However, we still need to balance, a working economy so that our country can survive. Throughout history, though, it's one thing that I was talking with another colleague of mine, was that throughout history, though, there are instances where governments have come together and have wiped the debt of a population or a nation. So it's just a matter of, like, I would not be surprised if the notion of that started coming up. Whereas, I know it's already been discussed for student debt. However, now we're into multiple phases, right? So it's just a matter, it's a domino effect. If one person's fucking up, then the next person, sorry, are we allowed to swear? Is that good? We're on social media, right?
Yeah, it's fine.
So if one part of the country is screwing up, and then it's domino effect, and it affects all parts of the economy. So if we nip it in the butt when we can, that is definitely a factor or a possibility. The other part about it is also, like I stated, understanding what we're dealing with is a new virus. It's something new in the environment. We have no idea. One thing that was interesting to me was the fact that, okay, great, we have a virus that's acting kind of like the flu, but at the same time, you can catch it. Our tests are not 100% reliable, and then we can catch it again, apparently. What the hell?
So from everything that I've heard, once you've gotten it, and this was according to Fauci, you have a pretty good immunity to getting it a second time. That's what I've heard, just to clarify.
The consensus is you're pretty much protected once you get it.
Okay. Got it. So
well, I've definitely read of people getting it again. So they may be outliers, but that still shows that it can happen.
It's more of an outlier.
Is that it's mutating so fast, right? So we got different strains, just like the flu virus. That's why we have a shot every freaking year, is because the sucker mutates every year. COVID seems to be mutating faster. I mean, that's just from what I've read and what I have observed, right? So it's new, it's interesting. So it's just a matter of we're gonna have to learn how to either, one, live with it first, and then two, cope with it after.
Yep. No, I hear you, man. Let's bring it over to Vlad, and then let's get Robert in next.
I'm Red Vlad,
yes. Yeah, so I just wanted to kind of briefly chat about reopening and doing it smart, with an intelligent approach, kind of like Billy, what you were saying. The thing that concerns me the most about reopening the economy is the fact that there are a lot of people who are unfortunately not going to treat this as seriously as it needs to be treated. We've all seen pictures coming out over the holiday of, the pool party in the Ozarks, where the entire pool was just jam-packed full of people. I'd be curious to see 3 weeks from now how many of those people have come down with COVID. But you also have situations where businesses are now refusing service to people that are wearing masks. And you have people out there that are so up in arms about having to wear a mask and about not being able to eat at their favorite restaurant that they're walking in and coughing purposefully on managers. So while you do have a large segment of the population that is going to treat this very, very seriously, you also have a pretty substantial segment of the population in different parts of the country that are not. And the problem is, we don't live in isolated communities. People travel. That's why this thing came over from overseas. People hop on planes, people get in cars. So, you're going to get a situation where you have an outbreak somewhere in a community that's not taking this seriously. Someone from that community is going to travel and it's going to spread. And here we go with wave number 2. That's probably the biggest concern for me. And, we have in a lot of our big cities like San Francisco, like Los Angeles, like New York, Seattle, thank you. Sorry, I see that jersey and I just can't mention Seattle. I apologize. But in a lot of cities like that, especially, these big tech hubs, you have a huge part of the population that relies on public transit. And if you have people on public transit that aren't taking this virus seriously, that's another hub of potential spread. I mean, I just look at riding BART daily into San Francisco, and
Don't do it. Don't do it.
yeah, exactly, Billy. Thank you. But that's what concerns me is like you can try to do it. You can try to reopen as intelligently as possible, but there's still going to be a subset of the population that's just not going to listen. They're not going to believe that this is a real threat. And as a result, you're going to get situations where there's going to be more outbreaks, more hot zones that will pop up, and more death, unfortunately. And I hate to say it, like I hate to bring up the flu pandemic, the Spanish flu pandemic. There was a group in San Francisco that called themselves, I believe, the Anti-Mask League.
Yep.
And as a result of their actions, San Francisco became one of the hotbeds of the second wave of the Spanish flu. So
And they'll go down in history for it.
they already have. And that's what scares me, to be perfectly honest with you. That's what scares me the most about reopening. That said, I do believe we need to do it. We need to do it intelligently. We just really have to be in a position to put a stop to any activities that can cause another public health hazard.
Intelligent and American citizens doesn't really always go well together.
Yeah.
Oh,
We're
man.
some of us are college educated. We're good.
I'm trying to be optimistic here, Sham. I'm really trying to be optimistic. And
Working
yes,
for the best of people. How
How
about
are
that?
we going to beat global warming with that kind of attitude? Seriously.
Unfortunately, educated and intelligent don't necessarily mean the same thing.
I agree with that statement there, Jake, because I've seen quite a few people with college degrees and even master's degrees doing some really stupid shit throughout this pandemic.
I hear you.
But
Let's go ahead and take it over to Robert real quick. He wanted to get in on this one. Go ahead, Robert.
I think the good thing, I'm glad to hear most people in here are now saying that they want to reopen the economy, because at one point we were labeling the people that were out protesting want to reopen the economy as people who are anti-science or people that only cared about themselves. And I think a lot of people are actually realizing once we have 35 million people on unemployment, we have child abuse, spousal abuse, alcoholism, suicide all on the rise, that a full shutdown of the economy and leaving people sheltered in place for until however long until we get a vaccine was some people's opinion. Nobody in here, but some people on the media had written that we could be locked down for years at a time. I think that it's good to see people coming around and realizing that this is not something that we can just do forever. I think that there's different ways that different states and different cities go about it. I mean, you have states like Florida, that
Robert, sorry to interrupt, man. I just want to get in here real quick. To be clear, I was never anti opening the economy again. But I think my biggest issue with what's been going on is there hasn't been a unified approach to how to open the economy. It's all been like all different states doing their own thing. And, some states are obviously doing it a lot better than others, but yeah, I mean, I just feel like Georgia, for example, they opened sooner than anyone else, and they've had a spike in cases recently. Go ahead.
I don't even think that they followed the. I think President Trump had given Georgia crap for not following the 3-step phase where they didn't have enough. I don't know exactly the phases, but I remember Trump was giving whoever camp crap for not following the proper procedures on opening up. So I definitely agree that there's got to be a better consensus on how we open up. But I also think that it's not something that the president can say. I mean, he gave the steps, but it's not every state and every city can follow the same exact steps, because there's different population sizes and different ways about how cities go about that. Not everybody can open up the same. So I think that I think it's good that people are finally coming around and realizing that there's also dangers of shutting down the economy and other things we've learned, where most of the people that were infected with it in New York, I think it was something like 60%, were people who stayed inside their house. The CDC has now came out and said that the virus doesn't necessarily spread on inanimate objects like plastic. So, so there's a lot of things that we're still learning over this bit of time, but yeah, I think that we just need more information and hopefully get this economy going. So
Yeah.
we don't have the downfall of the shutdown killing more people than the flu itself.
For sure. Let's get Kylan in. You wanted to say something. Go ahead, Kylan.
Yeah, I definitely think that, we've reached a point where, we can't stay closed forever. It's impossible. And the reason why I say that is not only are suicides increasing, domestic abuse, child abuse, elder abuse, alcoholism, drug overdoses, but people are losing their livelihoods and their jobs. And my thing is, if the federal government and state governments would actually do a better job of, providing a safety net for people, we could possibly have done shelter in place longer. But obviously that's not going to be the case. So we need to find a way to smartly and wisely, get people back to having a livelihood, because, you can't have 35 million people unemployed. You can't have 25% unemployment and have a country. You just can't. But, I think to a lot of people's point is people aren't taking the necessary precautions. And that's a great point that Vlad made. When you look over this past Memorial Day weekend and you see beaches and boardwalks jam-packed full of people with no masks, and you see people in, Texas and Missouri having, pool parties and when everybody's, packed into a pool, or you have people without masks and no social distancing, packed in bars and restaurants, that's a recipe for disaster. And so I think we can, more appropriately open our country if people would actually take the responsibility, or should I say, take the personal responsibility to actually go by CDC and federal guidelines with social distancing and wearing a mask. Because I think, credit to Mitch McConnell, among all people, and credit to just recently Sean Hannity, two people who think different from me, who actually came out and said that it's very important to put on a mask. It shouldn't, wearing a mask and doing social distancing should not have anything to do with right or left, red or blue, who's manly or not. And so I think we're getting to a point where if you wear a mask, some people say that you're not being manly, or if you don't want to do social distancing, somehow it's tyranny. And so I think we have to, and I think that'll go into one of our topics later on in the broadcast tonight, when we're talking about what's real and what's not, and how to deal with, falsehoods. But, we have to be responsible to do proper guidelines to keep ourselves safe, or we're not only just asking for a second wave, we're asking for a third wave. We're already seeing a second wave pop up in pockets across the country. When you look at spots in Nebraska, when you're looking at spots in Iowa, when you're looking at spots in North and South Dakota, when you're looking at spots in some parts of Florida, primarily Miami-Dade County, the second wave is already happening. But the question is, also Alabama. So the question is, how do we mitigate that before we run out of available hospital ICU capacity, while at the same time having an economy? And so I think these are going to be very important questions to address in the coming weeks.
Absolutely. I want to go to Jules real quick, and then we're going to go to a Facebook question.
Yeah, so I wanted to say on the point of opening up, I'm slightly concerned because we are only now seeing the coronavirus becoming kind of a much bigger issue in rural areas. So now we're seeing a spike that's going to be in little patches here and there in rural areas, and they're less capable of taking care of this sort of thing. So as we open up, we're going to start seeing more and more of these little patches in rural and much more or less denser populated areas. So I'm a little concerned about that. I'm not sure that's indicative of that we're in a second wave right now. I think the majority of scientific organizations say the most likely scenario is that the second wave happens around fall, maybe slightly earlier, end of August, early September. So, and it seems like there's general scientific consensus of that. Another thing I wanted to address is that the coronavirus does not mutate quickly. it actually mutates quite slowly in comparison to the flu virus. So that's actually really good news because
Are you talking about this one or the coronavirus?
I'm talking about this
Nice.
particular one.
This strain.
And coronaviruses in general, they did a lot of research when the MERS outbreak happened and the first SARS outbreak happened. They started to do a lot of research on vaccines and things. So the vaccines they're working on now are actually jumped off from the research that was started when they were doing research from the vaccines for that, and those sort of fizzled because once MERS and SARS turned out to be not as big of a deal, they kind of stopped having funding for that, so they didn't really continue trying to work on that because coronavirus in general has not been that dangerous. Only a few times, 3 times MERS, SARS, and now. But the fact is, the amount of mutation that this virus goes through is so insignificant that a vaccine that can be created for this will probably work for decades, if not 50, 60, 70, 80 years. Some of the vaccines we work on now that we continue to have now for measles, mumps, rubella, and other things like that, those are the same vaccines that we've been using for 60 years. And it's not that those viruses have not mutated, it's just that they mutate at such a slow rate and they mutate in such a minor way that the vaccines don't need to be changed for that. I mean, eventually.
How long until we
maybe.
get a vaccine?
Who knows? I mean, it's really up to.
It's hard to say when it comes to vaccines because there are a couple different types. There is an attenuated virus. There is
I mean, some coronaviruses still don't have vaccines. I mean, like the smallest
most
amount of
of them
time for like a coronavirus to make a vaccine is somewhere like around like 4 years.
Yeah, I mean, the
President said-
coronavirus,
No, like
as we
18
know
months.
it, is a cold virus. I mean, we don't make a vaccine for a coronavirus or a rhinovirus because our bodies can take care of it. It doesn't really matter. There's no real reason to make a vaccine for that. But when we've had an outbreak like MERS and SARS before it, or SARS after it, they did start to do research on it. So we have a jumping off platform. So we actually have a little bit of a heads up on it.
Yeah.
So, I mean, I would say at the earliest, I mean, I'm no expert, but maybe sometime early next year is a feasible time frame to have
And
Thanks,
that's
Jules.
working
Thanks.
vaccine.
Russian
But who
product.
knows? I mean, there's a lot of
I gotta-
things that could go wrong in that.
I gotta jump in here, guys, because we got a Facebook question from Greg Thielen here, and this one actually is for Sham. And his question is, what determines good science? The numbers from the CDC keep changing. Government can't even give us reliable numbers. What do you have to say to that?
Yes, I mean that's a good question in the context of like how do we determine science? This is why we have the scientific method that relies heavily on peer review, as Jules you kind of added. Like the consensus is what we base things off. Data is going to fluctuate because we have a number of factors. In general, science is all about analyzing data, making new decisions. So something that we decide right now might change. For example, the fact that it doesn't transfer surface to surface, that was by assessing data. There was a new consensus to that, right? But this is why peer review is so important and why the scientific method is so important. But to the specifics of why the data coming out of different states could fluctuate, well, we have a political problem too that needs to be addressed, which is states like Florida were blatantly trying to suppress the numbers. In fact, the federal government has also been trying to do that. So the CDC's numbers are based off of what data it can actually utilize, and states are going to be different. But again, there's going to be fluctuation. This is the whole reason why it's called a novel virus is because this is uncharted territory. So different theories are going to prove to be false and some are going to be proven to be true. But again, scientific method relies on peer review. When you have collectively a world of scientists, researchers, and all of that come to consensus, that's kind of the guiding post on how we make those decisions until we have further more evidence down the line, like once we get a vaccine.
Billy, you wanted to get in on that one too.
Yeah, backing up a little bit, it's just a matter of I'm taking notes. But the whole thing is that one thing I wanted to highlight was the fact that this this coronavirus and this response is really highlighting how our country in particular works with the different states and the different state responses, right? So all across the board, we're having different types of responses and different level of responses, and seeing how effective those responses are, right? Both economically and both socially and medically, right? One thing I wanted to bring up too is, you know, we saw this a little bit in the protests of wanting to get back out, and you know, people going so crazy, and the freedom of being out and about, right? So it becomes a question of public safety versus individual freedom. So us as Americans, we're not going to give up on that very quickly, right? So we have a very good tradition in our country of supporting the freedom of being stupid. Really, we really do, right?
Mhm.
And you know, it's a freedom I defend. And the whole thing is that what boggles my mind. I mean, someone brought up the fact of you know, like a real threat, kind of like anti-vaxxers, right? And I mean, basically, the question that gets brought up, right, is so how much danger, how much threat to the overall population are we willing to accept, all right, in the name of our individual freedoms, right, in our country. And I think that's going to be something that plays out very particularly in the coming months too. So as we struggle to reopen, right? So sorry, I had a note and then something was playing, so I got
No worries, man. No worries. Thanks for getting in. We got another Facebook comment here, and I want to address this one to Hannah. This one is from Christopher Pleasant. Thank you for the comment. This pandemic has economically crippled America over a nothing burger, his words. Small businesses will be bought out in droves, and large corporations are going to have a monopoly, so get ready to start paying top dollar. What do you say to that as it relates to food chain and supply issues?
Well,
Go ahead.
False.
well, I'm just rereading it.
Damn.
So I've been noticing this too. It's really obvious. We've been reading it in the newspapers, updates from favorite businesses that are closing down due to not being able to withstand being closed for months on end. As far as the fact that that's happening isn't surprising given how little attention has gone directly into small business support. There were measures that weren't taken. There were not measures taken to ensure that the funds that were being given out to small business loans were actually going specifically to small businesses. And as consequences of it, we have got mom and pop shops all around town closing down. I think this is going to drive a huge wedge even more between our upper and lower economy, or what's it called? Sorry?
Upper and lower classes.
Exactly, our upper and lower classes, which is just devastating. I think he asked a question, maybe. Get ready to start paying top dollar. That kind of brings to mind details about food supply. So we talked about it the last podcast 2 weeks ago about how certain the way that our system is crafted as far as where our food supply chains connect to are two different threads. One for more larger businesses, bulk materials, and more specific ones for people, individuals, families from grocery stores. What our economy is needing is a revamp of where things are going and how we make it available to people. And then also just dealing with that shifting time of not having maybe having to buy in larger quantities versus smaller, waiting for our packaging methods to update, all sorts of things that need updating. And I think the food subject is just one example of probably many of a need of our country to be able to recognize a problem and quickly come to alternative resolutions and move forward with them in very active ways, full of energy and full of people working on it. We see this need in our medical system. We see this in needing anyway, we just see it in a multitude of ways, and I'm concerned overall for our nation that we have so much need happening and not what it seems like enough leadership to be able to bring to fruition those quick changes.
Right. All right. Thank you. Vlad, you wanted to respond to that? To what Hannah said?
Yeah. Actually, in response to Hannah, what you were saying, also in response to what the question that Chris had, the comment that Chris made regarding smaller enterprises being snapped up by large corporations and us not, having a monopoly and us having to pay top dollar. In reality, if you look at the American food industry, we have the illusion of choice, because it's very easy to go online and find a nice and handy chart that shows a bunch of different brands that you can choose from. And all those brands are then rolled up into specific companies. Like you've got Nestle that owns, over 100 brands. You've got PepsiCo that owns the same amount. So we have about 10-ish conglomerates that own a huge amount of the food production in this country. If you go to a grocery store, you look down at an aisle that has like canned tomatoes, for example, and you see 20 different brands. Those 20 different brands are probably owned by 3 separate entities. So to say that there's going to be a monopoly as a result of COVID and that it's going to lead to a lack of choice, we're already there. And in regards to to this being a quote nothing burger, I don't, we can argue that for days. I don't believe that it's a nothing burger. It's clearly something. There's been 100,000 deaths. It was downplayed. We said there was one guy. It was going to be 0. We've just crossed 100,000. Granted, there are infinitely more people that have recovered, but still, you can't discount the fact that 100,000 people have died. So, and again, this has brought our food infrastructure almost to its knees. We've got outbreaks in like meat processing plants across the country. You walk into a Costco right now, there's fridges that used to be stocked with beef that are now empty. So it's, like I said, I definitely don't believe it's a nothing burger, but I also don't believe that it's going to cause a monopoly. I think we're already there.
Gotcha. Let's go to Kylan next, and then Billy. Kylan, you're muted.
Yeah. So so Chris, thank you for your questions and participating in our broadcast. Just jumping in a little bit to piggyback on Vlad's point. I definitely want to say that 100,000 people dead and counting it certainly isn't a nothing burger, because again, this is just the first wave that we're going through. I typically believe that we're starting a second wave now, and we're going to have a third wave in the fall during actual flu season. So I think we'll be far past 100, even 200,000 deaths by the time this is all said and done. So definitely not a nothing burger. As it relates to a vaccine, we're still getting a lot of data on this virus all the time. We're finding out that it's affecting younger children. We're finding out that it affects additional parts of the body, whether it be the heart or the circulatory system. So we're still finding out new things, and so we really don't truly know how this virus is going to continue to affect our bodies. We know for a fact it's going to continue to spread and more people are going to die. And so, and we're also a long way from a vaccine. And so, I think, comparing tuberculosis to this virus is a little bit comparing apples to oranges because one is a bacteria and one is a virus. So that just has its own, scientific chemistry in itself. But I think, really getting data and really letting the scientific method, take over is going to be very important because we truly don't know is what we need to know about this virus. The CDC has been shifting data because they're getting shifting information. So we don't have all the good information. China's having a second wave and the virus is acting different right now in China. So we just don't know how this is going to happen. But what we do know is that we still need to abide by masking and social distancing because it's still spreading right now. It's spreading in Alabama. It's spreading in Florida. It's spreading in Southern California. It's spreading in Iowa. It's spreading in North and South Dakota. This is a fact. And so, I just think that if we're going to be serious about this, we actually have to work with an actual set of reality, with a set of facts that is not conjecture, that's not pandemic, that's not one of our good buddies' YouTube posts, but we need to actually address this from a way that's scientific, that's factual, so we can actually know how to save lives. Because, again, 100,000 people and counting isn't a nothing burger. And I think we have to find a way to continue to save lives and at the same time have a country. So again, thank you, Chris, for participating, for your questions. We appreciate that, and we want you to come back for future broadcasts and maybe even come on as a guest in the future. So thank you again.
Thank you, Kylan. Heading over to Billy, quick comment, and then we got to move on here.
Okay, I got three quick comments, though. I took notes. I'm sorry about that. Whole thing is, so nothing burger in my, from what I understand of it, yes and no. Okay, so the whole thing is that no, in the fact that this is a new thing. This is a new thing on the horizon, and that's right in front of us. That's now we have to tackle with, on top of everything else that we have to tackle with. No, in the sense of diseases, in the sense of flu, in the sense of other things that kill us. It hasn't hit the numbers yet. Yes, 100,000 people are a lot of people. Okay, 3,000 people died on 9/11, and we fought many wars for it. Right, that's still a lot of people. But when you're looking at the major numbers, and I hate to play devil's advocate, but it's just a matter of that. Yes, there are a lot of other things that kill a lot of people still that outnumber that. Bringing to our knees in the sense of the food chain. I don't agree with that in the sense that, yes, maybe some meat companies or some meat suppliers have had to shut down for an amount of time. Some stores have ran out of ground beef. I know I was at Costco and I couldn't get the organic ground beef that I like. However, that there was ground beef right there that I don't get that brand. We as Americans are a little picky in that sense. I'm sure if you go to all of our refrigerators right now, we have enough food to survive. And I've worked with many people that don't. So to our knees with the food supply? No, not by a long shot. Monopoly, if you look at history, yeah, we've gone there and been there and done that. Now history repeats itself. This is the age-old tale, right? So the whole thing is that who here remembers living through a monopoly? Nobody, right? So we're going to repeat the sins of the past. So it's a matter of if people get bought up and people get bought out, yeah, that might happen. But at the same time, I believe in our country in the sense that we're good enough to realize the error of our ways, or realize that how many people are getting hurt, and we can break those monopolies up again. We've done it in the past. We can do it again. So
yeah. Well said. I've got one more comment, and I want to send this one over to Sham. You ready for this one, Sham? So in reference to the number of dead from COVID-19, that number is not real. That number includes people that have died presumed with corona with no year. Hospice people that have died are marked coronavirus. These numbers are about a Fed emergency money if they are marked with coronavirus.
Yeah.
You saw it. I had a hard time reading that through because.
So my there's kind of two ways of approaching that. Number one, I think it's not necessarily just ignorant. It shows a genuine lack of regard for, I guess, maybe any form of gratitude for medical care workers to suggest that around the country, medical professionals who have literally taken an oath to do the best they can to preserve the health and well-being of people are somehow skewing the numbers to, benefit off of federal emergency, dollars or whatever. Now, are there probably some situations where, yeah, maybe there was, mislabeling or whatever? Sure, but that is such a small, minuscule number compared to the fact that, two things can't be true. Let's look at it this way. To suggest then that there's this grand conspiracy of, upping the numbers to make more federal relief dollars or whatever, then what you are saying is that the medical community, the medical professionals, healthcare community as a whole is corrupt, evil, and they're basically willing to lie, cheat, put people in harm's way just for some extra bucks here and there, even though the numbers all show that most hospitals are struggling tremendously right now. Healthcare workers are struggling tremendously right now because of the overwhelming resources that have been diverted towards handling COVID-19. So I don't just think it's ignorant. I think it's just blatantly just rude to the people that are risking their lives every day to go in there and do what they can to help people to save lives. That's really my thought on it. And I don't think that question, because that's a legitimately ignorant question to ask. And a stupid conspiracy that's not founded on any sort of actual empirical data or science or proof. It's just more conspiracy theory nonsense that people peddle because it makes them sound like they're cool.
For those of you who don't know, that was Sham being very calm. So
aren't hospitals getting paid more money though to label the deaths as?
All hospitals are struggling right now in terms of their finances. If you talk to them,
but that's not what I asked. I asked you if hospitals were getting paid more money to label deaths as coronavirus.
They get paid on a grant basis. They get X amount of money if it is coronavirus. If it does end up turning out that way, they get X.
And if they're put on a ventilator, they get paid more money as well.
This is true, but at the same time, all that other stuff is a little bit more expensive. So it's in the hospital's best interest to use that particular set of money to treat that particular case as best they can. And then whatever else is left over is profit.
That actually was addressed in Plandemic, which actually we're going to get to next. I think it was like $39,000 that hospitals actually get if they put somebody on a ventilator. And they actually debunked that by saying a lot of that money is because of the respiratory therapists that they have to pay to actually help that person breathe.
Money.
Yeah.
You also have to understand. Sorry, you also have to understand that a doctor and the hospital are two different entities. So the doctor works for the hospital, but they're not beholden to the hospital's profits. So they do what they're supposed to do. The hospital does what they do. If there's smudging of records, that's up to
Well, it might not even be smudging.
The doctor's not going to be doing that.
It might not even be that they're necessarily smudging the numbers, but I mean, when you have people that have comorbidities, and someone may have major heart problems and they die of something like influenza, and they didn't get tested for coronavirus, then they're more likely
Doctor would
to
never
label
put that on though. If the doctor, like had something, they'd write it down and then they send it to the coder, right? And then
I'm listening.
Like because they write their diagnosis and then they send it to a coder, and the coder writes down, like they do all the billing. They said like, this is what he diagnosed, this is what they gave you, this is the amount of bedtime you got, the room, et cetera, et cetera, et cetera. So all the doctor does is say, this is what I treated. And so if somebody dies of whatever, some condition that's outside of COVID, and the doctor recognizes that, and there was no test, they're not going to write down that it was COVID. They have no incentive.
Well, New York did that though. New York had jumped their numbers by something like, I think it was like 4,000 that they added because they had changed their guidelines to say that people that most likely died of COVID had died of COVID, and they had changed their numbers for that.
So I want to jump in for a second here. I've been looking this up on Snopes while we're talking, and I have mixed feelings about Snopes, but it's definitely a useful resource. And they are saying that there's a mixture of truth and false to this, and I'm just going to quote it. They're saying it's plausible that Medicare is paying hospital fees for some COVID cases in the range of figures shown during the Fox News interview, which is at 13 to 39, I think. That's not clear here. What's false though is that Medicare does not standardize one size fits all payments to hospitals for patients admitted with COVID and diagnosed and placed on ventilators. The $13,000 and $39,000 figures appear to be based on generic industry estimates for admitting and treating patients with similar conditions. So that's like, somebody took some numbers that don't actually apply to the situation. We're like, oh, that's what they pay if this happens. So that's what's happening every time here. And that's not necessarily true at all.
But those numbers may not be right, but they're still getting paid something for having coronavirus deaths. And I'm not
to go bankrupt.
What?
Would you prefer hospitals completely go bankrupt since they make the bulk?
I'm not necessarily saying that there's any conspiracy theory with it, but I do think that there is a problem with the comorbidities problem where someone may die. They might have coronavirus, but there was something more severe that they had. Whereas if they were healthy, they wouldn't have died. I think that there should be a better labeling on how people die with comorbidities than just writing that they died from the coronavirus. I'm not saying, because I think that the hospitals should get paid that money, and I'm not disagreeing with anything along that line, but I think that there are some questions to be asked. And I know USA Today also did a fact check on it and had said that for the most part, the hospitals were getting paid for labeling as COVID. But I'm not complaining against it. I'm not disagreeing with it. I'm just kind of stating what else I've heard from the other side.
I mean, if you get an extra check, why not? I mean, they're dead.
Yeah.
From a
We're
funding
funding the
point,
hospitals. It's not like it's going to a corporation.
Yeah, no.
from a funding
agree.
standpoint,
I
it
understand.
makes sense that there would be money allotted for this, and so patients would probably be the easiest way to keep track of it.
Well, also, let's just add the majority of hospitals make their money from elective procedures, and they're not able to do those right now. So they're like, that was kind of my point of like, okay, so should they go bankrupt then? But
they're coming back.
A lot of hospitals are going bankrupt throughout like the Midwest. Where people
they're
are,
struggling
yeah.
right now. For sure.
Yeah,
Especially in
it's
rural
definitely
areas,
a thing.
smaller hospitals for sure.
Exactly. I 100% agree, and I wasn't peddling that. I was just trying to kind of be a devil's advocate here. And
again, we haven't really seen anybody's bill yet that has actually recovered, so we can see, oh yeah, they got charged X amount for
I think I've seen some, but not a lot.
I have a friend who's recovered. I'd be willing to ask her.
Yeah, do it.
Be interested to know. Yeah. Guys, it is now 8 o'clock. I want to get into the next topic here. So, Lewis, do you want to segue us into that one, or?
Yeah, I mean that kind of touched on it a little bit here. The whole pandemic, conspiracy theories, and just the whole thought process behind, just how you come to these particular decisions, and where, these thought processes are being formed from or informed by, whether it's social media or your particular religious group or whatever the case may be. How is it going to be that we effectively communicate with each other if we're all coming to different conclusions about the same topic?
And this is in regards to Plandemic, the video that came out on Facebook.
Pandemic, but just we don't need to deal too deeply into other conspiracy theories and stuff like that. But just the whole, like I said, thought process behind is it going to be safe for you versus how another person thinks, oh, I should probably stay home and really never leave my house again because it's unsafe.
Mm-hmm. Let's get Sham on this one first. I know this is right in his wheelhouse, so go ahead, Sham.
Yeah, so I was kind of giving thought about this, and I've mentioned this in other episodes, and we could totally get more into the details of it. But I think the fundamental problem, and I know in the past I've kind of like made it be about intelligence and like people are stupid and all of that, which I think is just me kind of. True, but it's like, let's look at the root of it, right? Because it's very easy to say, well, these people are stupid, but I had to kind of pull back and think about like my own experiences. Like I'm very much like an amateur UFOologist and things like that, right? But I approach it from a skeptical viewpoint. And what I realized, the primary problem that we have when it comes to everything from conspiracies to anti-vax, all of these things, we don't have a shared baseline of truth anymore. We don't have a foundation of fact that we all hold as, okay, we agree on these things, right? We disagree about these things, but we all base it off of this foundation of truth. That no longer exists. And that is the driving force in why people can believe everything from flat earth theories all the way to, you know, the anti-vax stuff. We don't have a shared baseline of collective fact that we all hold as, okay, but this is real. So we don't even work from the same place of reality, because I have friends personally who think that we live in a world of there's the evil powers that be that control everything, and 5G is brainwave frequencies that are going to activate microchips. Like, it's literally detached from reality, right? It's the same as people who live in a world where they think the earth is flat. So the root problem of this is that we don't have a shared baseline of belief. Like, I use this analogy with Robert, like, he's conservative, I'm progressive. But we'll at least agree on, like, okay, like, we agree that, you know, the sky is blue, right? And then we could disagree on policy on these different things, but we share that belief. That doesn't really, like, that's not really a thing anymore. And it's not just one-sided to political parties. I'm always very clear on explaining this is a problem across the political spectrum. I know anti-vax, the most progressive liberals that are anti-vax, and again, across the political spectrum. So I think that's really the main problem that I see. And then should I address that comment, or do we want to let some other people?
I'll address Akira's comment.
Okay, cool. Oh, actually, yeah. Can I speak to the comment? All right. So, all right, I'll just make it real quick. So, as a transhumanist who's all about cutting edge technologies, AI, cybernetic augment, everything. Again, to suggest that this is, you know, a leading doorway to technology and has been targeted to older people, do I believe that it'll expedite technology? Of course. But to suggest that this is some conspiracy to kill older people just is outright false. There's no science behind that. There's no. Again, I'm all about the technology. I want the robots. I want the AI. But I'll be the first person to say that is categorically false. That it's not just being used to, you know, create 3D marketing and things like that. So that's my stance on that comment.
So I wanted to speak to Akira's comment in a little bit of a different way. You know, Akira, first of all, thank you for your comment and for taking part in our broadcast. And I hope you join us for future broadcasts and share and like our site. I definitely can understand the anxiety that you're feeling. I think it's people across the country and across the world are feeling a lot of anxiety. And I hope that you can find a way to cope with that, and we can all find a way to cope with that. I'm hoping that, you know, it's unfortunate that when you look at the pandemic on its face, it does seem to be affecting certain segments of society much more broadly. You know, our elderly population, our infirmed population, a lot of, you know, our population that are in minority and underfunded and underserved areas. So I don't think there's a specific idea or specific plan to kill people off on purpose. I don't think that's the case. But I can definitely tell you that, you know, that certain population groups are affected, you know, more broadly, and it's unfortunate. But I think that, you know, to Sham's point, I think we need to deal with things on the basis of fact and from a lot of data to be able to find a way to beat the virus, to be able to save lives, to be able to save our economy. And I think when we do those things, I think it'll reduce your anxiety a lot. I think a lot of people's anxieties and fears will be reduced when we can find a way to beat this virus and get things back moving and again in a way. But just to let you know, and just my personal thoughts on the matter, our country wasn't necessarily just hunky-dory and a perfect utopia prior to COVID. You know, we had serious issues of income and wealth inequality, serious issues of pollution, serious issues with climate change, serious issues with police brutality, serious issues with a lack of regulation, environmental regulations, you know, serious issues with division before COVID. And so I'm not saying that this was, if we all get back to work and if we open everything back up, everything will be fine. But I do think that this can be an impetus to kind of revisit and, come up with a different way that we can make our country better coming out post-COVID. How can we have a better supply chain infrastructure moving forward? How can we have a better physical infrastructure moving forward where we can use roads and bridges and technology to move goods and services to low income and needy areas that need to be serviced? How can we have new technologies that can help an AI that can help diagnose diseases and sequence them earlier to save lives? And so I think this can be an impetus to try to make our country and make our world a better place long term, and really take our country into the future and lead. I think that the United States of America should be leading the world in technology, leading the world in saving lives, leading the world in truth and science. And so that's my hope, Akira. And again, thank you for joining our broadcast.
I just want to make one quick thing about this is a planned way to get rid of older people. So again, as a transhumanist, all about AI, advancing technologies, everything. I want all of it. But if they were really trying to kill the baby boomers and older people, this is the dumbest, worst, most horrible job ever to create an engineered disease or a virus, that has such a high survivability rate. So if you look at the numbers at the end of the day, they didn't do a very good job if that is true. So just
it's a learning curve.
I'm like, they could have done a better. It's a ridiculously high survivability rate. It's still a huge problem. It's still super dangerous. But if this was engineered to kill the older people, then they did a very poor job at it.
Agreed.
You can say the same for mustard gas. Okay, we made a gas. It kills really quickly. The wind blows the wrong way.
Right back at you.
Right, exactly. So we're learning. We're getting it. So
the next one will do better.
COVID-21 is going to be
pandemic too.
That'll be our shining moment right there. Robert, you want to get in real quick or?
Yeah, I think the one thing I wanted to kind of address was the whole aspect on how we really choose what is real news and what isn't. I think in an area of me being where I'm for absolute all free speech, I don't think that really anything is considered hate speech, or I don't think anything that is speech that is addressed, whether it's the pandemic documentary or flat earth documentaries. I don't think that we have anybody that is qualified enough to take an unbiased approach and look at what is truth and what is not truth. And for an example, someone may think that, the president had said something like there are good people on both sides in the Charlottesville rally. Well, I disagree with that. I had heard him say something like, well, I'm not talking about the neo-Nazis and the KKK. We have two different opposing opinions. Now, one of those opinions might want to put that up as truth, that he said that KKK and neo-Nazis were good people, but I would be on the side and saying the exact opposite. Now, who's going to go in there and be the arbiter of truth to give the truth to everybody in a unbiased way? I think that everybody holds some kind of bias, and to have one entity arbitrate what is truth really wouldn't do any good. And it goes along the same lines of religion. People have different religious beliefs. I don't think that we should be able to block their beliefs, or I think the only way that we get around of finding truth is through debate. So I think that having these videos out, whether it's pandemic or, the LDS church having something on YouTube, I think the only way that we are able to really find truth is by letting them speak their message and finding the truth within their content or within your logical reasoning. And so I think it's a dangerous line that we go down when we start having Twitter fact checking what people say, or having some entity label what is truth or false.
Billy, over to you real quick to respond to that real quick.
So Robert, I agree with the fact that, debate is the way we learn, right? And unfortunately, what we've seen in our country is that debating is something that is shunned upon, right?
Uh-huh.
We're in a political climate right now where it's either my way or the highway. It's like those of us who've read a fucking history book have stayed, can understand. It's like, well, that's not democracy or anything near it, right? So it's concerning, especially concerning to me. I just read about that. Trump is lashing out about social media because they're fact checking him. If you're the president of the United States, okay, you're a figurehead. Maybe the words that come out of your mouth should be thought about just a little bit.
But the problem with that is that there has been proof that mail-in ballots do cause more fraud. It
You
may
can,
not be
absolutely. But here's the thing. Any
yeah, we'll
type
get to
of
that
system that
topic.
we have, any type of system that we have, right? Whether it be mail-in ballot, whether it be reading a fingerprint, whether it be scanning your eyeball if you remove it from a corpse, it can be taken advantage of. All right.
Yeah.
So no system that we're going to come up with that's going to be foolproof.
Yeah.
But debate, the idea of respecting each other enough to have a conversation, even if we disagree, that is being shunned right now, and it's very concerning. And I'm a conservative, right? I don't agree with a lot of things that are said, but at the same time, I respect the notion that other people are going to disagree with me. That's fine.
Amen.
And the going back to go back to what Caitlin said. It's just a matter, or Sham, sorry. What Sham said was the fact that we have a lack of foundation on common ground, right? I find myself at times thinking of myself as an endangered species in the political spectrum, because I'm kind of in the middle. Okay, like I respect the fact that as a male, I shouldn't have any right to tell what a female should do with her body, right? But at the same time, oh geez, what I'm saying, getting to the point where I can see both sides. Okay, but I'm in the middle. That's something extremely rare right now in the political climate that we're in. In the religious aspect, it's frightening at times, because we have people in power that believe that we are living in the end times, and maybe sometimes that they have to do actions that bring about those times. Kind of scary, a little in a nutshell. I myself, I was baptized Catholic, never practiced any religion, so I know I'm going to go to hell, which is fine. But at the same time, I do believe, from what I have seen, what I've experienced, and the miracles that I have witnessed, we are in a chapter that hasn't been written. I think we're beyond the book, and we're taking notes as best we can. There's no baseline. We've surpassed all baselines, and we've gotten to the point where our founding fathers of this country had warned us about is the fact that our country was not designed for a two-party system. It wasn't, right? Because what do you get with a two-party system? What we're seeing today, you're either with me or against me, right? And that's a Sith. That's not democracy. It doesn't work very well. We need to get back, I think, a little bit on the same playing field. Yes, we can agree to disagree. I think that's a civil thing. And unfortunately, we've lost a lot of politicians that used to think that way in the past decade alone. Foundation, collective basis. Yeah, I think that's a lot of the points that I took notes on. So sorry, I've been drinking, guys.
How dare you show up to this podcast drunk?
I'm not legally.
He didn't show up, he got drunk. They're different.
Oh boy.
Progression on stream.
Understandable. Really understandable.
Wait, yeah, I mean, what's 2 hours? It's good.
Right. Lewis, jump in. Then let's take it over to Hannah.
Yeah, because I wanted to add in the religious aspect of it, and I know I have family members that are seeing this particular coronavirus issue as God's plan, and just having to have that discussion with them. It's like, no, this isn't God's plan. To if you catch it and you die, then that's it for you. That's what God has in store for you. That shouldn't be the way that
Maybe
you're looking at things. And, I was just kind of blown away that, this person that I've known for 11 years, that's something that came out of her mouth. And I was just like, oh, I don't know how to feel about that other than just, speechless, really. So I wanted to kind of ask Hannah, I know, you said that you do come from a very religious background, or at least family members that are very religious. How have you been having to have those kind of discussions with them, or even, have you had those discussions?
Well, I haven't been having those specific discussions. Something that I'm frequently addressed with when I bring up really anything that happens in life is a response that God's taking care of me. I'll put my faith in Him. The responses are, it's like anything that happens in life can have an upside when you turn God into it. And I struggle with facing this so frequently because what it requires of me is to be able to have the oomph and the energy to come back with, what about this situation? What about these situations? And then to me, that ends up creating what feels like a wall between myself and the other person of, I'm threatening their beliefs by questioning things that they have one answer for. And that answer might evolve into various verses or scriptures, but I know I'm facing this specific perspective, and that's all I'm going to get to work with. So one thing that I've studied in the past has been, it's called nonviolent communication. And it came up because I was raised with ways of communicating that for myself evolved in having violent type verbal responses. And I don't know if anyone else has experienced this, but sometimes when I'm communicating with people that hold a religious beliefs, if things don't go their way, or if they're questioned in certain ways, a response gets very forceful or loud. It's not logical dialogue. It ends up breaking down. So if anyone, sorry,
you have emotion involved. That's why.
Definitely.
In my experience, yeah.
Definitely. And years of believing a thing and being told things of ways that this is the way of life. And anybody that comes to meet that with science, logic, reason, details, it's just like, it's battling worlds. And so I've been really curious about how other people feel about addressing this conundrum. And real quick, I'm going to read what violent communication steps are. So the four fundamental steps of nonviolent communication, according to Marshall B. Rosenberg, PhD, are: observe without judging, express feelings, express clarity of your needs, and express specific requests based on your feelings and needs. And I don't mean to get, too self-help, but the reality is that we need help on this subject. We need these vastly different groups of believing peoples to be able to effectively communicate with each other and not get offended and offend each other. And that just doing so just breaks down all dialogue potential. So I wonder, if I were to go about doing this more, which I've begun to do this with family members using these steps, what can I gain from doing it? And I'm curious, what can our nation gain from doing this? What kind of fallout can we avoid by being able to exercise these communication skills?
Yeah, no, and that all good points, Hannah. Thank you for sharing that. Vlad, you wanted to respond?
I didn't necessarily want to respond to you, Hannah. What you're saying actually makes a whole hell of a lot of sense to problem in this country with people not really knowing how to properly communicate, especially with those who hold beliefs that are that are different. Let's just say. But I think one of the biggest issues that I've noticed in my life, not super long as I've been on this planet, but there are people that we deal with who refuse to acknowledge anything that contradicts their beliefs, regardless of whether or not it's a fact. You know what I mean? Like, this is actually, there's a quote from the Dalai Lama that I respect immensely. And I don't have the text in front of me, but I think the gist of the quote is, if science is able to disprove any tenet of Buddhism, then Buddhism will change. And I respect that, because there's a subset of the population in America and in the world who, for example, they'll believe that the sky is green, and you can take that person, walk outside with them, point up to the sky and say, look, it's blue. And they're going to look at you right in the face and say, no, it is not. And I think that's kind of the problem. Is it's kind of like what you were saying, Sham. There is no real basis for what's true and what's not anymore. And people refuse to accept facts as they're provided because they go against their beliefs. So what you really have is in certain situations, you have one side arguing facts, you have another side arguing beliefs, and neither will agree on anything. And there's no common ground. There's no sort of, in that situation, everyone has to agree to disagree to try to spare hurt feelings. But in reality, in a situation like that, there is no real agreement to disagree, because in some situations, one side is wrong and one side is right. So that's kind of, that's what I have to say on that.
Yeah. I took a few notes about a couple of things, and to Vlad's point. So I do think we need to be arbiters of truth, and I can kind of demonstrate why. Vlad, like, to your point, if you right now debate someone who's anti-vax and you cite peer-reviewed data after peer-reviewed data, the general consensus of the scientific community, or let's use a hot button issue, climate change, same principle. They can just outright say, well, this is all fake, this is all false, these are paid shills, they're these people, all of these different arguments that literally, it's not saying, well, I disagree on that data. It's basically throwing it all out, saying, well, I don't believe in any of your facts whatsoever because it's all fake and this is just a giant conspiracy, right? They can literally say, with 5G, for example, it's so easily to disprove because if there's no conspiracy behind it. It just, laws of physics, it's non-ionizing radiation. Like, it doesn't affect biological matter when it's it's basic physics 101. But they could throw that out and say, well, I don't believe that that's some fake conspiracy, even though that's been known for a long period of time. The UV spectrum is well studied. So that's the first point. The second point, and this is kind of going back to the whole reason why we need to regulate truth and be arbiters of truth. This is actually a technology problem. Ironically, our advancement in technology has led to this in a weird way. You would think it would lead to us being smarter, but it actually hasn't, and this is why. I kind of wrote a few notes. We used to have a consensus. If you think about it, school books, taught a baseline agreed upon, foundation of science. And what's occurred through technology is we've decentralized and expanded on the channels of communication. So let's just say you were a flat earther, you might have been able to get a video camera and make a documentary. You had to get that approved by a TV station or whatever to get that actually broadcasted, right? If this was, say, 30, 40 years ago. If you wrote a book on anti-vaxxing, right? Like, you would have to get that published. And there were regulations on what we held as common truth. So this is actually a result of decentralization or deregulation and allowing everybody to broadcast their messages and their channels, because it's not that hard to create a YouTube documentary. And I want to kind of tie it in with the religion thing too. Religion, ironically, has a shared baseline of truth. Like, it might not be rooted in science, it's based off of faith, and I don't even want to get into that discussion, but you can't just show up at the church and say, well, you know what? I don't believe in this gospel. I believe that what it really meant was this. The church would say, get out of here. That's not true, right? You can't just show up at any type of religious establishment, right? So it's funny how even religion has a shared baseline of truth that they adhere to, that they hold as gospel. And there's an arbitrary, like, it's literally regulated on what they allow. So of course, I don't think freedom of speech should be controlled, but when you need to have layers of fact checking, because if not, to this situation that we're in right now.
We should call bullshit, is what you're saying.
I think we need to, well, yeah, because it's
A little
not
bit.
new. Yeah, that's true. Because textbooks, for example, were like what we learned in school, we're all relatively within the same age, was not like, oh yeah, UV light, this is the spectrum, and then 5G, there's a theory that 5G causes this, right? There was a shared basis of truth that
But the victor goes the history books.
That is true. That's absolutely true.
In the history books,
it's a new idea. To be arbiters is not new. Like, we've done this for a very long time. It's only as a result of technology, ironically, that has caused this whole spread of. That's why there's so many more conspiracy theories than ever before, because it's not hard to make a YouTube documentary and share it.
So there's some things I find really frightening about the concept of finding a way to bridge the divide with especially the deeply religious community, because what we have here is, like Shem said, we've got a long history of arbitrating the truth and defining what true is based on science and experience and objective truth. But you've got a group of people who more and more, they've stepped away from that. They've moved away from communicating logically, from thinking logically. And now the rest of us who want things to work well are having to discuss how we can bridge the divide and communicate with them when they've left the mode of communication behind. That's a downward slope, and I don't want to play that game. Like, it's a problem. Those people need to be communicated with, but if we continue to play a game where they get to step away from the like long-standing accepted modes of communication, philosophical logic included, then we're just going to degrade our society left and right in order to make that happen. And that's not worth it to me. Those people want to skip out on educating their minds in that way. That sucks, but it shouldn't be the rest of our fault to pick up after them. And, I'm sure it's obvious at this point. I come from a background that was focused more on questions than anything else. So agnostic at best, atheist, something
also,
like that.
I would add, you can have an idea or a theory. I always use this analogy. I believe in UFOs, but I don't state with any type of fact that UFOs exist. If you said, what's your evidence? I would say, well, if you look at the statistical probability based off of the sheer vastness of how many stars we have, there's highly likely a chance that there's extraterrestrial life. But that is not a fact. That is simply a theory that I believe in, but that should not dictate truth. That should not reflect in any type of policy to accommodate my beliefs, because it's not in science. Until freaking ET lands and comes out and says, yo, we're here, there's no scientific fact behind that. Until there's peer review on that. Like, let's just say an alien landed on the White House lawn, said we're here. Until peer-reviewed science actually looks at that and says, oh no, this is actually true. Again, like, it's not a fact. So this goes back to the whole point of why we need the scientific method and why it's so important.
I think ET showing up would be good enough.
And the same holds true for God. Unless he shows up when we can prove it, it's just an imaginary friend.
It has to be testable. This is the whole point of scientific method. It has to be testable and a method that could be replicated. So again, you could believe that, it's stuff, whatever, but that doesn't make it true. You need to have the responsibility as a skeptic to first and foremost, like I said, I strongly believe in extraterrestrials, but it's not a fact. It is simply just a theory that I adhere to. It's that simple.
So Hannah mentioned in our background chat that these people, they hold office and and that's a problem, because it means that we have a divide in communication and a divide in the power set. So we've got
Wait, what people hold office?
people who have this difference in communication, people who are, say, deeply religious or conspiracy theorists or whatever.
What's wrong with being religious and being in office, though?
Nothing specifically, except we do have a basis for separation of church and state. So if you institutionalize anything to do with your religion, then you're just breaching that right off the bat. So you hold your religion. That's awesome. I support that, but keep it to yourself.
Why keep it to yourself? My biggest thing, especially when we're dealing with religious fanatics, I'll use that term, that refuse to listen to any other argument. But the whole thing is that you can turn religion. My biggest thing is the fact that, okay, God made us in his or her image. Don't know until I find out, right? But the whole thing is that we're made in their image, correct? Right? So if science is something that we have developed on the earth plane, which my mother coined the term, I like, the fact of the matter is that what we're practicing and what we're talking about and what we're doing, isn't that something that God has instilled in us, right? So religion and science shouldn't be two separate things. They should be together and working
Religion,
together.
science was originally the pursuit of God. So I just agree with you on that's just accurate. But if you were to be in an office and then push your set of beliefs, that's not okay.
That is where we're hitting the point, right? Because throughout our entire country, right, you have the right to belief, you have the right to protest, you have the right to speech, you have the right to live your life however you want to live. But when you start pushing your beliefs, your actions, and start pushing onto other people, that's when it starts crossing the line, right?
Do we have examples of like politicians doing that?
Off the top of my head, I mean, when we start getting into city councils and local municipalities that are voting out certain books out of certain school districts because they don't necessarily agree with the words are in that book, well, then you're limiting the knowledge of our children to learn and make decisions on their own based on the information that you're providing them, right? Or in certain states or counties that limit the amount of sex education in public schools because of religious beliefs or religious feelings, or along the lines of just a collective belief, okay? Then you're setting those kids up for a life lesson that might not be the most, you know what I'm saying? So you see where I'm getting at, where it's just a matter of like, yes, there are consequences when you have a certain thought or a certain belief or a certain group of people that are in power, and that they set those into regulations and laws.
Wouldn't they also believe things like sexualizing kids at a young age though?
Depends on the religion. What religion are you looking at?
Well, I'm not even saying it has to be a religious belief, but couldn't their belief just be that like sexualizing kids at a young age by teaching them sex education could do more harm to the kid? Like maybe their arguments aren't just
depends on the religion.
God said so, though.
Well, let's ask this to you, Robert. We went to the same elementary school, right? Vallecito?
No, I went to Marysville.
Okay. From what I remember, it was in 5th grade or something like that.
Yeah.
That's when they started teaching us sex ed, but it was very, very basic concepts of what a man's junk is versus a woman's junk and how it all kind of comes together.
Yeah.
You're on in middle school and in high school, then they got it further into, STDs and, safer sex practices and things like that. So, there should definitely be sexual, sex education, but maybe not so much in elementary school, maybe sometime in middle school or, early parts of high school. It really comes down to
how much crap do you remember from elementary school?
What's that?
Tons.
How much crap do we remember from elementary school? I remember 1 or 2 fights.
It gets internalized.
I remember the fights pretty well.
Yeah, you remember
math, basic math.
Whatever makes it.
That's important to you, at least.
Well,
but yeah, then it also comes down to particular PTA groups that are saying, well, no, the kids shouldn't be learning about all this stuff this early, and that might also come from a religious decision or, personal experiences, that kind of thing. But yeah, that's one thing that we could definitely ask.
Yeah, and I don't necessarily, I'm not even taking the stance because I'm not super religious. I do believe that there is a God, but I don't think that all politicians are all over making their decisions on because God told them. Their decisions are on what's best for society, and that might
I don't
happen.
know. I don't know
But
what
as
goes on.
informed by their religion, though, as informed by specific tenets that they've been taught by, whether their religious organization is more conservative or more liberal or more centrist or not at all. I mean, people are going to be informed by those religious insights that they've had and the core beliefs that they've been taught their entire life. And of course, those things are going to be, it's to a degree, unconscious, but you can separate out like, oh, this is my religious belief. This is what's best for society. These are two different things. We're talking about like women's reproductive rights that have a huge religious argument against them and a huge scientific argument for them. And where, what's the difference in those, and where do you find a common ground?
But there's also go ahead.
Sorry, that's just one example, but there's been judges and governors who put the 10 commandments on the lawn of the city hall, and things like that and the argument about prayer in school, which is a dramatic example of infringing upon separation of church and state. And those are huge issues that, and I think Trump or Pence has said something along the lines of, and I can't think of a specific quote, but I could probably find it, saying there needs to be more prayer in schools. It's
I think
sad
he had
that
done some
prayers
kind
in
of
schools-
executive order or something like that.
Yeah, and that's a clear violation of separation of church and state. It was written into the Constitution for a reason, because people have a tendency to take their beliefs and impose it on people. And of course, the history of this country is fraught with that sort of idealism. And we came in, we said, oh, all these Indian guys, got to get them out because they don't believe what we believe. So, obviously there's hypocrisy in all of it. But I think in order to try and make a better nation, try and create a better state in which we live in, it's important to say and acknowledge that everybody has a different set of beliefs, and it's not fair to impose your own on everybody else.
But the problem is, where do we draw the line? Because in the 10 commandments, you have one of the commandments is thou shalt not kill, right? Are politicians pushing
Right, but I don't
policy
think
of
the
not
morality
murdering?
of murder has anything to do with God. I think everybody, whether I wasn't brought up religious at all. I am an atheist. I don't believe in murder. I don't think that the commandment, thou shalt not kill, comes from a divine perspective. It comes from a moral perspective and an ethical idea that it's a fucked up thing to kill people, right? I don't think it,
Yeah, but
I don't think
how
that
do
has
you know-
anything to do with a religion at all.
I'm in a place.
Yeah, but it's still exactly. But so then, how do we draw the line on whether they're following religion or they're just following a society, a societal
if they say
morality?
Jesus a lot, then they're probably following religion. Jesus said this, Jesus said that. God didn't say that. God, in theory, said thou shalt not kill, but that was already pretty well established before Christianity was a thing. Every
I don't know about
society in
that.
history has.
Are you kidding?
The Native
society in
Americans were
history
murdering each other on
right.
a daily
With justified
basis.
things, war is justified, legal killing. Throughout history, there's always hypocrisy, but on a societal level, in ancient Greece, if I walked up and killed somebody in the street, I'd be arrested for that. And it
Depends
wouldn't,
on who you kill. Depends on who you kill.
And then we go down the
I
aspect
don't know
of
about that. Do you?
we go down the aspect of abortion and stuff like that. And I'm pro-choice, but you bring up the the topic of science, but there's a lot of people out there that say after 4 to 6 weeks that once the fetus has a heartbeat that it's necessarily living. Now, would
And
you
that's
consider
very
would you consider that
philosophical too, right? I mean, but the
would we consider
philosophy
that
they're
murder?
using. No, I would consider that the choice of an individual. And this is a philosophical argument that you could have for a long while is when exactly does life begin? I mean, does life begin after a fetus is viable to live outside the womb, or is it before that? And that's difficult to assess. But the argument against it is almost always used within a religious context.
Let's Jules, wrap up your point real quick, and then I want to go over to Hannah next.
Oh, I'm good.
You're good. Okay. Yeah, go ahead, Anna. Let's get you in next.
Well, so I just wanted to share off of, I think Jake had started the thread about religious folk bringing their beliefs to the table of our lawmaking procedures and what agendas are being pushed. And I just wanted to share from my personal background. I grew up in the church, mostly non-denominational churches, and it was talked about pretty thoroughly, the desire that there is this wave of movement of Christian beliefs moving into government and wanting more people to step up and become government leaders that held these specific beliefs. And that agenda itself has a complete direction to do exactly what we're concerned of happening, and that's writing into law beliefs that extremist religious folk hold. And I think that's a huge problem. It's a huge concern, and we have a lot at stake. So there is a question brought up, I'll read it, from Christopher Pleasant. Is science not based off a hypothesis or theory based if it can be replicated? How is that any different than religion? So whose truth? Because there are some things that science can't prove. So what I would say to this is that science itself is not just able to be replicated. It's a tested result. It's doing something enough times to getting a consistent answer, being able to prove it. There is a lot about religious beliefs that are not tangible, not able to be proven. And let's see. That's all I have to say to that, is that I think of our religious background as humanity as something that makes sense that it evolved and that we have it, but that as we grow as societies, we learn more and more about our world, and that new information should be replacing the old beliefs that we've had from religious doctrine. And we need to be able to discern what is agenda of religious leaders from back in the day carried over till now, and what truths really need to replace those beliefs.
Excellent.
I want to jump in real quick and respond to that question from Chris too. And so I'm not entirely sure that I understood the wording, but what I think he's saying is equating religion and science, and they're not the same. And if science was to go about applying the scientific method, which, like Hannah said, does utilize rigorous replication and peer review, and actually come up with some empirical evidence for God, like, I'm the most aggressive atheist out there, I would be thrilled. That's awesome. Great news. Fantastic. But till then, nothing. And you know, religion is a really awesome set of stories that if you like is fantastic, but you can't equate it to science, which can be proved.
You can't also prove that God isn't real, right?
Not
I
saying
mean,
that I'm not saying that they did. I'm saying that without evidence of it, there's no reason to assume it's real.
Well, can you just say the same thing? Without evidence, you can assume it's not real. I mean, I understand the argument of not being able to prove a negative, but there is their aspect that nobody
I never said it wasn't real. I choose not to live my life based on it.
No, I'm not saying you are, but I think that they also would make the argument that there is no proof that God isn't real as well. So.
Well, so okay, I've got an imaginary pink elephant that tells me all sorts of great shit all the time.
Mm-hmm.
Nice.
Tell me that's not real. Yeah, right? Fantastic. It also tells me that you need to give me all of, I don't know, 10% of your earnings all the time. Well, come on, fork it over. The pink elephant says so. You can't disprove that.
You're right.
That argument sucks.
Yeah, in a logical way, I guess it does. But I mean, it also goes the other way as well. Whereas where I can't prove it, I mean, you can't prove the other side as well.
Sure.
So if we,
I just don't. Why follow something that you can't find any evidence of anywhere?
Let's go ahead and get Hannah.
I mean, that book 2,000 years ago.
Take the
So-
parts.
Harry Potter will be around in 2,000 years.
No,
Take
wow.
parts that work.
I ain't no Huckleberry fan.
Yeah.
so
Okay.
if we
Who's
were
next?
to
I'm sorry.
apply the 4 steps of nonviolent communication to that particular back and forth between you two, a person that comes at it with that argument or you can't prove that the God's not real. So step 1, just for the sake of it, let's reflect on that. Observe without judging. Okay, so both sides, let's assume that we can do that. Express feelings. Both sides did.
Mhm.
Express and clarify your needs. Now, this is where we have concern, because if needs are being infringed upon by laws being made based on beliefs that are intangible or not able to be proven, then that's a real need concern. That can be spoken between people. And if we can express specific requests based on our feelings and needs, that's the agenda. And I want our world to be able to do this. And I think the more that we're willing to get to steps 3 and 4, the better. And more specifically, ensure we're doing that with one another. And I think that can help move past some of this brick wall. What do we do with these varying extreme beliefs?
I agree. I just don't see all these politicians trying to pass these laws in favor of religion. I mean, I would agree if it was something that was rampant or I'd seen it a whole bunch, but I just don't see it necessarily.
It's a little harder to see it out here, but if you're out maybe in the South or Midwest or something like that, you might see it a little bit more. But it's pretty hard to see that over here in California. So
Yeah.
Women's
you're
rights
right.
and like abortion laws in Georgia kind of speak really loudly to me. And that's the state that I'm from, and that's the state that I can't and would never move back to, given those restrictions.
Mhm.
They're basically telling me that if I go home, get pregnant, I would get a felony if I left and went and had an abortion.
Mhm.
But the locking of
That's
science.
based on this. Are they real? Are fetuses human beings? Where do we draw the line? Is that murder? There's a lot of history religious backing behind this.
So the whole question about religion, like, okay, cool. So let's go with that. Which God? Shiva, Allah, Jesus, like which god of Odin, which god are we talking about? So this is one of the fundamental problems with religion. Talk about God, okay, well, which one of the thousands of different religions are we going to base these things off of? So this goes back to why science is important. One of the fundamentals about the scientific method is that scientists want to be proven wrong. Like we have to keep that in mind. They're constantly looking at data and saying, okay, like let's test this theory. And then if we could be proven wrong, great. And then more importantly, before we could say this is right, it has to be something that everyone else could replicate it. Religion, on the other hand, is saying, hey, let's take these books written 2,000 years ago, 3,000 years, again, pick a religion and you could date it back to whenever. And this is truth, and don't ask any questions either, because this is the infallible word of God. And if you question it, then you are committing blasphemy. There's a massive difference between those two different approaches and methodologies.
I think religious people ask questions all the time when they're reading the Bible. I mean, that's how they find their beliefs. I mean, it's not like you go to any one church and they're pushing the same thing as another church. I mean, I see plenty of churches with LGBTQ flags out in front of them.
But they're not questioning the validity of the book of Genesis. They're holding that as faith, and to question it is to commit blasphemy.
We got to move on to the next topic, guys. Quickly, let's wrap this up.
That's kind of my point to it. Like, you could question the interpretations, but you can't question the baseline truths of it. Meanwhile, there's still physicists that are questioning whether Einstein's theory of relativity is true or not, and they're constantly trying to debunk it because that's science. But you can't go into a church and say, well, yeah, you could interpret, the Gospel of Matthew or whatever, but you can't question the truth of Genesis or the crucifixion of Jesus and all of those things. And again, there's no actual evidence there's no historical documentation. These are based off of faith. So that's the fundamental problem in comparing the two.
Sham, we're out of time on this topic. I want to get to the last one here. We're going to go down the list here, and everyone's going to share their favorite conspiracy theory. I want to start with Robert. Go ahead.
Oh, geez, I'm starting.
Here you go.
My favorite conspiracy theory, hands down, is the assassination of JFK. I was also really happy when Donald Trump had released the documents behind the assassination of JFK. I've watched plenty of documentaries on it, whether it's Jesse Ventura talking about it or whatever, from the grassy knoll and the Dallas textbook building, all that. I spent a lot of time on that conspiracy theory. I really like it. And JFK was also, even though he was a Democrat, he's one of my favorite presidents. So
yeah.
Wow. Who wants to go next?
Oh man, I'll jump in on this one.
Let's go, Kylan. Let's hear it. What do you got?
So I'll have to say my favorite conspiracy theory has to be Pizzagate. Number one, I love pizza.
No.
Number two, like, who thinks of the fact that Bill and Hillary Clinton are running a secret pedophile sex ring in the basement of a pizza place? I'm like, for God's sakes, you have Jeffrey Epstein's island, for crying out loud. Why do you want to go into a pizza parlor in New York?
Nobody would expect it. Everyone would go with the island.
Nobody would expect it.
Oh my goodness.
That doesn't look like pepperoni to me.
Wow. Good one, Kylan. Who wants to go next?
That cheese is a little too gooey.
I can take this one.
Let's go, Vlad. What do you got?
One of my favorites by far.
That sausage?
What's that?
I said, is that sausage on that pizza?
Ah, jeez. I'm gonna take this away from this. I'm gonna go to a geographical conspiracy theory. I love this one. I think it's hilarious. It is the theory that Finland as a country just does not exist.
Oh, I love that one. That's so good.
It's just no Finland.
And of all countries, it's not something like in the middle of the ocean, like New Zealand or something like that, or like
part of Scandinavia.
Yeah, or like Taiwan. It's fucking Finland, man. Like, Finland doesn't exist. Russia went to war with Finland.
Jeez.
And there's some idiot out there convincing people that it doesn't exist.
Yeah. I'll have to check that one out.
You're talking about the numerical one, the population-based one, right?
I don't recall the specifics of it. I just remember reading about it a while back, and it stuck with me, because how can you try to convince the world that an entire country doesn't exist? And there's actually a group of people who believe this.
So the humor of it is it's based on the government census with a margin of error of 1% for the planet, and Finland being less than 1% of the planet. So they just not there.
Yep.
Let's go to.
I'll jump in with the next one.
Okay, go for it.
I think that for full tilt bullshit, birds are cameras is my absolute favorite. That one kills me right now. It's absolutely
Never heard of
fucking
that one.
hysterical.
Never even heard of that one.
I have long been a conspiracy theorist. I love conspiracy theories. I dig into them. I think they're fantastic examples of the human mind. But the birds one is like top funny. That's so good.
See, I was gonna use that one, but I've got a backup, so that's fine.
Good.
Let's go to
That's why I
Lou.
wanted to go early.
Son of a bitch.
Yep. Yeah, I'll jump in with the next one there. I'm not entirely sure if this is a conspiracy theory, but a lot of people were thinking when the Large Hadron Collider was first going to be turned on and they were going to start, hitting protons together, that it was going to create a black hole that was going to swallow the whole fucking Earth in it.
Would have been a trip.
That just
Yeah,
happened. That's why we're in the dark timeline.
Or
That's not a
create a-
conspiracy theory. It's just a story. It happened.
Or create a gate to hell. That's why CERN was around.
Something like
Those
that.
ones are crazy.
All Satanists or something like that. So
Uh-huh.
Pretty soon the Doom guy is just gonna show up.
Oh
hey,
my god.
he is our savior. Okay.
I just beat that game, man. I'm ready.
Sham, man, I can't wait for this one. Go ahead, buddy.
Ones to choose from. I have so many UFO ones, but one of my favorites is the reason why we haven't been back to the moon is because the aliens there told us not to come back, and the moon is actually a giant space station. So that would probably be, and they're there.
Did they kindly tell us to get off their lawns with their space
Yeah,
shotguns?
they basically said you're not. Follow them moon landings.
They
That's
look like the Moonanites, right?
something like, yeah. There's a couple different, but there's space station. There's settlements on the moon. Aliens are there. That's like their base, and it's
They're on the dark side, right? Dark side of the moon.
yeah, exactly. Yeah, literally, they're on the dark side of the moon. So
I bet they love the album.
Brilliant.
that's
Stanley Kubrick wrote the story for that one when he filmed the fake
Yeah,
space moon
I got a
landing.
local one for you.
All right, who we got next? Let's go
I'll jump
to
in.
Billy. Go ahead, man.
Yeah, so actually this is a local one I learned when I was stationed up here in Washington. Apparently there are lizard people under Mount Rainier. So
Oh, be careful, man. Robert actually believes that.
Yeah, that
What?
that
Do
is
you?
something
I thought you said you did.
Believe in
Lizard people.
lizard people. So
No, you got
I'm
confused. Sham believes that one.
Oh, that's right.
Hey, shut up! I want to hear about the lizard people.
There's some people in Yelm, Washington. That's a thing, and then it's just a matter of like we used to joke about it on active duty. It's just like I do not want to get called up for that fucking fight. Like I really don't.
Yeah.
the correct title is Draconians, by the way. That's their actual species name.
Yeah, we can't win if we got to go toe to toe with that.
Name
Fuck,
them.
give up.
All right, Hannah, go ahead.
It's hard because I don't have a favorite one. The first one I ever participated in was 9/11, and I really dig that. Mostly
You
'cause
participated in 9/11?
Yeah. First conspiracy theory I participated in researching about and really getting into. So probably that. I got under my dad's skin a little bit with that one. It was fun.
That's funny. Oh my god. Who we got left?
You got me.
Jules?
Yeah, Jules, let's go.
So one of my favorite ones here is that Meghan Markle, who married Prince Harry, she's part of an international conspiracy to reabsorb the U.S. into the United Kingdom.
Why would they want it?
Oh, what?
Why would they want it? Who knows?
Yeah, it's like having a bed house.
There's also one that
300
says she
years
might be a
manuscript.
robot,
We're gonna
which is
screw up that.
ridiculously hilarious. There's another one that I particularly like that says Nigeria's president is a clone. There's no evidence or rhyme or reason for this. Some people think he's a clone.
Well, there's one
There's
along
like
those lines that
there's
says
literally nothing to say that he's clone. They just like, no, he's a clone now.
Well, Jules, there's one along those lines that says that Melania Trump is a body double that just walks behind him at public appearances. That she doesn't actually exist.
I actually wouldn't be surprised.
Jeez.
All right. This is I guess
dude.
we'll go with mine last. This
Make it a good one.
Yeah.
I don't know how I can follow these up,
Lizard
but
people.
and this
Eat it.
isn't necessarily like a mainstream conspiracy theory. I just happen to think that Tupac is alive and living on Richard Branson's island.
Why Richard Branson's Island?
Huh? Because it's
What?
like nobody would
'Cause
find him there.
The gig
And
is
Richard
up at
Branson, you
Epstein's
know that dude
Island.
would keep it secret, right?
So is
Is that
Richard
why he's
Branson
still
just
putting
like
out better
getting?
albums than Kanye?
They secretly got a recording studio out there, and they're dropping some fat new beats.
That
So
nobody's gonna hear. That's
nobody,
See, he's releasing them under a different name,
and a different label.
keeping it all pure underground.
All right, ladies and gentlemen, that is the end of tonight's broadcast. Thank you so much for coming. Really appreciated having you guys all here. If you have any suggestions for the next podcast, please leave them in the comment section below. Like and subscribe, etc. Everybody, we're signing off. Wave goodbye. All right.
Niner.
Have a good night, everybody.
The 11th, Raiders, baby.
tough.
Niners.
Take care. Good night, everybody.